the beginning of 2023 is when her situation started with coughing, very heavy coughing, until September 2022 is when she became so critical. She could not walk. All her body became so weak. Her legs, she could not carry her legs, and everything of her so weak. She became so weak. In that village, there was a breakout of some flu. At first, it was thought as just a normal flu. Other children in the village, after a while, everything went well, but for her, it has developed further to a serious condition, which we could not understand until after months, 6 months, is when her situation became so bad that we had required her to visit a hospital, because at that village there's no hospital at all, even a level 1 hospital. That is when she came to Wajir town. In Wajir town, she has undergone some few tests. Of course, they could not also establish the cause of it, because they said her heart imefura. When the doctor saw her, the first thing he suggested was to do an echo to see how her heart is functioning, because her legs were big, her body, all over her body, it has become so big. So a lot of signs. So maybe that was the first reaction of the doctor. He suggested to do a test on her heart. That is the first time we heard about echo, which was done, and the doctor established that she has a rheumatic heart disease. He also referred to us to a surgeon in Aga Khan. The surgeon saw the report, a video report and an X-ray video report and all the medical history. The doctor recommended surgery.
Rani amekuwa akiwa mtoto hakui, hataki kula, yani mtoto hana appetite. Sawa, unampeleka hospitali kwa sababu hiyo hakuwa hataki kukula. So ni kitu yenye amekuwa nayo kama miaka kama 5 anaendelea nayo. So kujua na shida, alikuwa akikohoa anashika moyo. Kikohoa anashika moyo. Sasa tukadhani ni mafua, tukampeleka hospitali. Baadaye hiyo shida ikazidi. Ikabidi sasa tumpeleke Malindi. Hapo sub county Malindi General. Sasa tukaambiwa tukuje naye Mombasa, tuje kuangalia zaidi shida iko wapi pengine. Tukakuja hospitali nyingine inaitwa Gertrude, tukapigwa picha, tukaambiwa moyo na shimo. Sasa baada hapo ndo tukaanza sasa clinic za Raya, ni kuanza namfuatilia Malindi, nikaenda mwezi mmoja Malindi, mwezi mwingine natumwa huku, nakuja naye Mombasa mpaka kufikia hii leo.
Tangu kuzaliwa ndio tujua alikuwa na shida ya moyo. Alikuwa na miezi 4. But kutoka kuzaliwa kwake alilala hospitali akiwa na wiki 1. Hatukujua kama ako na hiyo shida. Sasa tukaambiwa tutafute daktari wa echo. Nikatumwa Kenyatta, si kuenda Kenyatta, nilienda Mpisha. Huko ndio alifanyiwa echo. Nikajua ako na hiyo shida ya moyo. Nikauliza shida kama gani? Nikaambiwa ako na shimo kwa moyo yake. Sasa kutoka hapo nikutafuta na kumpeleka clinic, akaanzia madawa hapo sasa hadi wa leo.
Majina kamili naitwa Ndaro Abdalla. Saburi ni mjukuu wangu. Saburi ana umri wa miaka 7. Tulipoanza kumzaa akakaa iko na flu, tukatibu flu. Baada hapo tukampeleka hospitali, tukaambiwa ni pneumonia, tukatibu pneumonia. Baada hapo akakaa bado asikii vizuri. Tukarudi tena hospitali, daktari ndo akasema tukapime moyo. Baada hapo tukaenda Msambweni hospital, ndo tukaanza kupiga picha, ndo tukaambiwa moyo wake si mzuri. Baada ya miezi 2 alizidiwa, tukaletwa hapa Makadara. Tulipoletwa hapa Makadara tukatibiwa, nikaona watu wengi wana ugonjwa huo, nikajipa moyo, kumbe nasema Mungu hakunionea. Sasa hii ndio naendelea na matibabu.
Nilipoambiwa Raya kwanza nilipoambiwa kuwa moyo wake ni mkubwa, nilishtuka, lakini baadaye mimi nikaona tu ni picha, pengine picha hutoa vitu zozote. Sasa nilipokuja Mombasa kuambiwa Rani moyo wake una shimo, nilishtuka, nikashindwa na venyewe nasikia watu moyo mtu akiwa na shimo haizi kufanya nini. Sara na alikuwa na hiyo anafanya vitu kawaida, anaenda shule, anakimbia. Lakini sasa ikaanza kunitia hofu, nikaanza kushindwa, si mtoto wangu basi atakufa kama moyo una shimo. Nikawa naulizia madaktari, je, kuna suluhisho pengine kama moyo una shimo? Daktari wa Gertrude akanambia kuna dawa mtoto nitamuongezea, alikuwa anatumia ile lax, akaambia nitamuongezea shimo itaziba. Sasa tukaendelea na dawa nayo alipoanza kupewa akaanza kujikuna sehemu za chini, anajikuna. Sasa tukatumwa Pandya tupigwe picha nyingine. Tulikoenda pigwa picha huko Pandya tukaambiwa shimo haitaziba, yaani ni afanywe surgery, hiyo ndio inaweza kuwa suluhisho ya mwisho. So tukaendelea na dawa, na pia tukawa unajua ile unaongeleshwa daktari, japo madaktari walikuwa wazuri. Ukiendapo kama umevunjika moyo, anakuambia basi mama, hii ni kitu kidogo tu, mtoto ile shimo itaziba na mtoto ataendelea kuwa na maisha mazuri. Sasa kama mzazi haukubali kwa sababu unafikiria kuingia theater, moyo wenyewe, moyo basi uguswe, usijue ufanyweje, ulikuwa unapata ile maswali mengi. Lakini hata hivyo mwisho wa siku nilikubali kama mzazi, nikasema tu acha mwanangu kama atafanyiwa, kama hiyo itakuwa akifanyiwa atakuwa vizuri, basi mimi nitakubali afanyiwe, na hao mengine Mungu anajua.
Kutoka wakati nilijua Simon ako na shida ya moyo, nilihuzunika sana na nikajiuliza sasa nitafanya nini. Sasa nikaanza kutafuta ile njia Simon anaweza saidika ili atibiwe hiyo shida ya moyo.
After we made a visit to Aga Khan Hospital, we had discussed with the treatment plan. He told us it will cost us about 1.7 for the whole procedure, and it could even cost us more after we have done the surgery. So that was really too much for us. He had prescribed for her some few medicines to stabilize her. So she has been, after 1 week she was stable. She was able to walk on her own. She could do everything on her own. So from that time up to today, up to today that the surgery was done, she has been under that medication. She was stable. So because she became stable, now we had to go to several hospitals to look for where we can get help. After that, after Aga Khan, now we went to Tenwick. We had discussed also with the treatment plan. They did a test. They had recommended also the surgery, but also the cost was really too high for us. We could not do it. We left again. So another friend suggested for me a hospital in Eldoret called Moi Teaching and Referral Hospital. They had a camp. Fortunately, we had succeeded to be put into that camp, but unfortunately they had some machine breakdowns. After Moi Teaching and Referral Hospital, we chose to wait for any other hospital which can give us some help. The next hospital we went was Mata Hospital. The heart run they normally do, I also found that from a friend who is in that heart run. We went to Mata Hospital. Mata Hospital was far much cheaper because there is an organization that was chipping in, that was bearing the part of the cost. Part was NHIF, and the other part, which I think will have been not so much, but even that's not so much, we were not able.
Changamoto ilikuwa ni hiyo fare. Ukiambiwa kuje Mombasa, fare ni shida. Hiyo fare kutoka huko, kwa sababu unajua tena maisha, na unamwambia kabisa daktari, unaniambia niende Mombasa, lakini sasa hii sina hiyo pesa. Sasa inafika kliniki nyingine, si unakiwa baada ya mwezi, inafika kliniki nyingine hujakuja Mombasa. Sasa daktari anateta, mimi nilikutuma peleke Mombasa mtoto na hujampeleka kwa nini? Sasa unamwambia hali zangu hazikuwa nzuri. Sasa unajikaza unaamua vyovyote bora umlete.
Kujua hii Care for Heart nilijulia MPSha. Kuhusu rafiki yangu nilimwambia tukiwa Kiambu kliniki, nikamwambia twende MPSha kuna watu wanakuja mpisha. Hapo ilikuwa mwezi wa last year November. Sasa kwenda huko tukafanyiwa echo tena, tukaambiwa mimi siwezi saidika huko, nipeleke mtoto wangu India. Na huyo rafiki yangu mwenye nilimwambia twende, nikamwacha huko yeye akafanyiwa hiyo operation. Sasa kutoka hapo mimi nikamwacha nikaenda nyumbani. Kutoka hapo akanipigia simu. Akaniambia kuna watu wamekuja kuleta watu wengine huku, akanipea namba. Akaniambia nipigie Susan na nimwambie mashida ya Simon. Wakati nipigia Susan akaniambia anafanya care for heart, nimtumie document ya Simon. Sasa kuanzia hapo sasa tumepelekana na hiyo organization ya care of heart mpaka wa leo.
While I was in Nairobi, just waiting for help and doing some research, I got a message from a friend. He shared with me a post. I think it was a Facebook post. He shared with me that there is this organization called Care for a Child's Heart. Why don't you give it a try? I googled, I got the number. I tried to call one of their team member, I think, received the call. We talked. They were really receptive and very welcoming. So they told me the camp will be held on was it 18th or 19th July. Go to Mombasa and try your luck. The tests were done. Unfortunately, and by God's grace, we were successful to be selected.
Nikienda clinic, huwa yule daktari atamwattend Ryan, nachukua namba ya simu. Ndo Ryan akiwa na shida yote nyumbani, nimpigie simu nimwambie Ryan na hiki na hiki mimi nafanyaje? Huwa sitaki nimnunulie dawa ya dukani. Na ilipoanza shida nilikuwa simpeleka hata private tena. Kila kitu na deal na huko hospitali kwake kwa clinic na nabeba kitabu chake. So ilipokuwa hii ndo ndo akanipigia simu akanambia kutakuja madaktari wenye watakuwa wanafanya upasuaji. Je, mama uko tayari mtoto wako afanyiwe? Nikamwambia niko tayari kabisa kabisa.
Shirika hili nililijua kwa sababu gani? Kwa vile ninakwenda clinic, ukitokezea wafadhili kama hivi, tunapigiwa simu. Ndio nilipigiwa simu, alafu nikaona kwenye WhatsApp.
Care for a Child's Heart exists to support children from needy backgrounds who need open and closed heart surgeries. Every time we receive a needy case in our organization and we walk the journey with these families and we see there is very good outcome. Let's say sometimes we receive a child who can barely walk because they've stayed for a very long period with a congenital heart disease. Us seeing them go through surgery, being able to lead a normal life, motivates us every day to continue working harder and support many more kids.
When I look at little children who are innocent and cannot do much for themselves, it motivates me as an individual to do everything that I can to assist those families who may not have the financial wherewithal to address the medical conditions of their children. But at the same time, when you save a child, you're saving the future of our country. And so I feel very attached to the plight of these children and to do whatever we can do to assist the children to have a better life.
The 2024 mission started on 18th of July, and the first day we came to Coast General Hospital to screen the children. We had a very good turnout. We had around 52 kids who came for screening, and out of the 52 we selected 20 who need heart surgery, and so far the progress has been good. So today we are on our 10th case. We have 2 kids who have already gone to the ward, ready for discharge in the course of this week, and we're really looking forward to good outcome by the close of the camp.
Our lead surgeon, Dr. Roberto, who came all the way from Italy, has already operated on close to 20 patients as of today. By the time the camp is completed, we'll probably complete about 22 or 24 open heart surgeries. In addition to that, we'll take a break and we'll conduct additional closed heart cases sometime in September, where we hope to do another additional 20 to 30 cases.
My relationship with Care for a Child's Heart is 1 year old. I was called last year I immediately thought that it was a great opportunity, and it was very timely with respect to my career, stage of my career, so I could put my experience to share wherever there's a need.
We are mainly dealing with surgery for children who have congenital heart diseases. These are diseases that children are born with. They are present at birth. Then they are noticed either at birth or afterwards. Many of them have got holes, or the vessels, the connection of blood vessels to the heart is deranged. So this mission is basically to correct those problems so that these children can live a better life.
I'm really motivated, even just as a chairperson or somebody who's part of this noble cause for care for a child's heart, because we fix every child's heartbeat one child at a time to ensure that they have a good and fulfilling life ahead. And even just seeing how dedicated our nurses, our doctors are to ensure that these children are able to live a fulfilling life really, really motivates me to ensure that both the doctors and the nurses are happy, but at the same time, even the family members of these children who, are living a life of slight struggle, but have a light at the end of the tunnel, ensuring that they're able to have a fulfilled life once their surgeries are done by our team.
First of all, we've not been doing complex congenital heart diseases in this part of the world. Complex congenital, they are actually very complex problems. Sometimes the operation can take 6 hours. Yeah. And when you evaluate later, you find the repair has been done very well. From the last mission, we follow these patients in the clinic, and we can see that the patients have done very well. Their parents are very happy. So it's a very nice mission.
Pressures kwa sasa tokea amefanywa ile tiba, pressures yuendelea vizuri. Hana tatizo lolote. Yuko sawa na yuenda shule. Hivi sasa ni mwaka mmoja tokea pressures amefanywa upasuaji na yuendelea vizuri. Wakati pressures akipelekwa surgery, nilikuwa nahisi vibaya sana kama mzazi, hata nilikuwa nahisi kumpoteza. Nilihisi kama nitampoteza. So wakati nikiwa pale, nilikaa pale siku 4, lakini hata chakula sikula. So sikuwa nahisi njaa. Nilikuwa niko na maumivu makali sana moyoni. Lakini kwa kweli Mungu ni mwaminifu. Alipofanyiwa na akaamka, nikasikia faraja.
My typical day in working with children is we will be ready to receive them from the theater after operation, and we have to take a good handover from doctors that what they have done, what medications are going on, and what we need to give them again. And again they would be on mechanical ventilation, so the medicines we have to record the vital signs. That's very important. And yeah, the first day is quite challenging because you have to monitor
the facial expression you see from the parents. You feel like crying because they can't take it, seeing their kid is not breathing, they're on life support. The kid is basically cut through the chest with very many tubes, very many wires, very many things around the body. I mean, you can barely see the skin, So for them, maybe it's their first time to see a person in that kind of condition, but precisely this is their kid in that position. So for them, they can't take it. Some of them cry, some of them try to be strong, but you can see from their facial expression that they are not there. So for me, that's usually a heartbreaking moment, but I think it's what drives me into really working so hard and making sure these kids survive so that they can also be happy and go home with their kid.
And then the second day, we plan if the child is doing good, we see the parameters, and then we decide to extubate the child. So yeah, it's on the first, second day we can say, but from the third day, it's more like the child becomes stable, and then we plan him to move out to step down ICU, or we transfer them to ward.
Now, surgery is the result of multidisciplinary activity, and in which anesthesia is involved, the team of extracorporeal circulation, and surgery. We all aim at the scope of doing it right the first time. It's not to have any residual problem, and to truly impact positively on the lives of these patients.
My highlights for the 2024 camp, I'm looking at the cases that went through surgery on 20th when we started the cases, and seeing these kids go through surgery, being in ICU for a couple of days, and now discharged to the ward, out there playing and being able to just lead a normal life.
The highlights of the 2024 camp has been the conducting one of the rarest forms of surgeries. It's my understanding that less than 3 cases have been done in Kenya, and the other 2 cases, unfortunately, were not successful. But in this particular case, under the leadership of Dr. Roberto Di Donato, a surgeon, a pediatric cardiac surgeon who has over 40 years of experience, who is the lead surgeon of our organization, was able to successfully conduct a surgery on a child right here in Kenya at Coast General Hospital. And this was the first of its kind right here at this facility. And I'm pleased to let you know that the child is doing very well, and we do expect the child to have a full life ahead.
Sahi Ryan anaendelea vizuri baada ya kufanyiwa. Sahi anafanyiwa mazoezi ya kutembea, anatembea vizuri mwenyewe, mpaka anaweza toka kwa bedi akashuka chini, akakaa kwa kiti ya plastic na akashuka na akaenda choo mwenyewe akiwa hajashikiliwa na daktari. So anaendelea vizuri, na mimi mwenyewe nina amani kabisa.
Sahi anaendelea vizuri, anaendelea kusikia nafuu. Sasa amebakisha kidogo sana, na naamini Mungu atamponyesha hapo mahali amebakia. Fiche ya Simon, najua itakuwa maisha mazuri. Tena namuombea akikuwa mkubwa awe mhubiri, ndio akuwe na hiyo ushuhuda mahali ametoka na ile shida alikuwa nayo akiwa mdogo, aelezee wengine wasikufe moyo.
The surgery was done on 1st August, about a week now. Yeah, but after just 2 days, she has been just okay. Basically, she can walk. She's okay, Kapsa. She can do everything for her. She can walk, she can eat, she can talk, she can bath, and she's just like a normal person now.
Toka mtoto wangu atoke upasuaji, nashukuru Mwenyezi Mungu. Sahii anaendelea vizuri. Jana nilitoka ICU, nimekuja kwenye hodi, naona maendeleo yake ni mazuri. Anakula chakula, anatembea. Sahii haemi kama vile mwanzo. Nashukuru, anakula. Tunaendelea vizuri, anatembea, si kama pale mwanzo. Mkuu hawezi kutembea sana, lakini sahii nashukuru kidogo, namuona anatembea vizuri.
Chenye naweza sema kuhusu CFAC, nasema kuwa tunawashukuru sana, maana sijui pengine tungeanzia wapi, lakini kwa moyo wao na ukarimu wao, Mungu awabariki sana na awajazie kila mahali walipopunguza. Mungu awabariki, maana peke yetu tusingeweza kabisa kabisa.
Care for a Child's Heart prides itself in the number of partners that we have. One of our biggest partners is Heart Gift, which is based in Austin, Texas. They are our biggest benefactors, and we partner with them with regards to the African region. We basically undertake almost all the surgeries that HeartGift needs to be done in Africa. In addition to that, we've been very fortunate to form a new partnership with Medtronics, which is one of the biggest suppliers of medical devices and consumables. And they have generously donated to this organization, which in turn has lowered our cost of consumables. Also, Felling Instruments, a surgical instrument company that is based in Germany and has a big division in the United States, has generously donated surgical instruments for the surgeries that we conduct. We are also pleased to have a great partnership with Lakewood Church, which is based in Houston, Texas, who believe in the cause that we are undertaking. And I would also like to mention the fact that Emirates Airlines is one of our best partners. They provide the air tickets for the surgeons and the nurses to come from across the world to come and conduct the surgeries here. So we're really thankful to Emirates Airlines.
I request them to keep promoting this organization because they are really they're really hardworking in saving the lives, and I think this thing is the utmost important in our lives. When we save others' life, it's not it's not just about caring them, it's about how we connect to them, and how we are not just saving one life, we are saving the whole family's life, and we are promoting a life of hope, full of hope. So I request sponsors to keep promoting and keep helping this organization.
We have so many children who need support, and we would want to invite corporates, individuals, and even foundations to join hands, come out strongly and support the cases that we have. For a single heart surgery, sometimes we may need around $15,000. It's not an easy amount for one to raise, considering that we are serving the very needy families in our communities. So I would call out for any sponsor who would be willing to come forward and support a child. We may not ask for much. The sponsorship may be something little, like just supporting a child get NHIF contribution per year, or support a child get medicine for a whole year. And we need this because we have many kids who need support.
Well, we'd like the stakeholders to join us as our partners. If you're maybe a cardiac surgeon and you want to participate in the surgeries, or you're a cardiac nurse, we would love to partner with you. But also to the general population in Kenya and the surrounding countries and all the other donors across the world. We are good custodians of the public's funds. 98% of the donations that are made to Care for a Child's Heart go directly to the cause that we support. And so if you make a donation in support of Care for a Child's Heart, you can bet that that money will not be used for administrative costs, etc. Much of that money will go towards purchase of consumables, payment for doctor services, etc. And the good thing too is that many of the doctors donate their time. Many of them, Dr. Donato does not get paid. He comes and does all the work for free. But unfortunately, we do incur some expenses, such as transportation costs, etc. And those costs are part and parcel of this mission.
It's never about money. It's always about life. And every coin really counts. If you donate that last coin and that kid is able to get that drug or that surgery, they might not thank you directly, but I'm sure they'll forever be grateful, like somebody helped me to get this surgery, this heart surgery, and that's why I'm alive to this moment. It's about the life that they have saved. So the much they donate, the huge numbers that we are able to do for these cases, we might move from 20%, do 35% of these cases, move to 50, be able to cover even 100%, zero death.
And to the sponsors, it will take a kind heart and a considerate heart to save a child, especially in Africa where poverty is so prevalent. I'll tell you to continue donating to the organization so that you will be privileged to help more children. The more you help, the more I believe the more you feel proud that you have helped humanity.
Mtu yoyote mwenye anajisikia kusaidia watoto wenye wana hizo shida, basi asaidie hii kampuni ya CFH ili iendelee kusaidia watoto wengine zaidi na zaidi, kuokoa maisha ya watoto.
I'd like to take this opportunity to really thank Heart Gift Foundation that has made this mission possible, and the doctors who have traveled from very far to come and volunteer in this mission. That's a real sacrifice that they've left their countries, come to Kenya, being here for 3 weeks, and join hands with our local team to make surgery possible. We really appreciate them. And thank you for the support also that we've gotten from the local doctors at Coast General Hospital. Some surgeries have taken longer hours, and these doctors have stayed up to till late doing the surgeries. We really thank them and the management of Coast General Hospital.
With a single procedure may change 180 degrees the outlook of pediatric congenital patients. And so that's why it is very important to save lives by giving this opportunity. I want to thank CFH for this great opportunity to work for the good of the children.
When you see a child with a heart problem and you correct it, and you see the child jumping around, a child who was initially blue, the eyes, the fingers, and after surgery, the child is able to play around, doesn't require oxygen, you feel very great.
Mimi nimeshukuru sana na nitaendelea kuwaombea zaidi. Msikufe moyo. Hata mtu akiwa na shida gani, msikufe moyo. Muwashikilie venye sisi tumepata usaidizi. Na tutakuwa na ushuhuda kusema kwenda kutangazia wengine huko nje. Hii care for a child care for heart inafanya kazi nzuri. Na ningeomba serikali ingilie kati, ishikilie organization. Hiyo ndio ombi langu.
Mimi chenye naweza sema, nataka kusema hiyo kampuni ya CFH tunashukuru sana kwa yale yote wamefanya. Wabarikiwe na wawe na maisha marefu, waendelee kusaidia hivyo na Mungu awabariki sana.
This is an exciting theme that we have this year. My Heart Goes On is reflective of the hearts of these children, the beating hearts of these children, which will continue beating for the rest of their lives thanks to the surgeries that have been provided by Care for a Child's Heart. We passionately believe that we get the highest rate of return on these surgeries, because when a child has had their defective heart fixed by the surgeons, they can live a full life. And that means they can end up being productive members of the society. They could be future doctors, future lawyers, future engineers, future carpenters, whatever trade that they decide to pursue. It will be our pride and joy to see them fulfill their God-given purpose on earth.